Welcome to Monday's edition of COVID-19. Proactive prevention measures, including vaccination, have been touted as the current most effective strategy against the pandemic. But recent developments in Brazil and Israel are casting a shadow on this widespread belief. Now, we have more later on in the program, but here first is the pandemic coverage with our Kwon So-ah. Now, so I see the weekend factor has pushed Korea's daily tally down.
Yes, it has, Sunny. And with that, Monday is starting off with 1,418 infections, and that includes 1,370 domestic and 48 imported cases. And with that, Korea has a total of over 237,700 infections and a death toll at 2,222. Now, if we take a look at our graph now, we are seeing a decline since Friday here. And also, if we go over to Monday's figures in the past week, today's figure does look better than in the past 2 weeks, but we still have to monitor the rest of the week to learn more about the current trend in infections. Now, this Monday, the capital Seoul and Gyeonggi-do province are seeing a little under 400 infections. The good thing is we are seeing no other places with triple digits this Monday. Now, despite the ongoing social distancing measures, though, with the Delta variant as well as the post-holiday after effects still lingering, social distancing measures will be extended for another 2 weeks with additional adjustments. So at restaurants and cafes, we will have new rules as those under level 4 social distancing have to close at 9 p.m. an hour earlier than before. Under level 3, the curfew stands at 10 p.m. The same rule applies for eating and drinking at convenience stores. Considering higher vaccination rates, though, fully vaccinated party members will be exempt from the 2-person limit past 6 p.m. under level 4, meaning until 9 p.m. a total of 4 people can hold private gatherings. As part of containment efforts, the government is also expanding PCR tests for workers at high-risk venues such as cram schools, indoor sports facilities, and department stores. In general, the extension of level 4 social distancing measures means that for the metropolitan region, Daejeon, Busan, and Jeju Island. But if we take a closer look, we also have the city of Chungju in Chungcheongbuk-do province, and also the cities of Gimhae and Changwon in Gyeongsangnam-do province under level 4. And for those, the measures will be until the 29th of August, just like Jeju Island.
I see. Meanwhile, So-ah, what is the latest with regard to shipments of Moderna vaccines here in the country?
Well, Sunny, following an earlier delay in shipments by Moderna, officials announced on Sunday that more than 7 million doses of the U.S. vaccine are to arrive in the next 2 weeks, with a little over 1 million expected to arrive here in the country this Monday. Meanwhile, authorities continue to encourage the nation's people to cooperate in the vaccination drive.
Each and every additional citizen who gets vaccinated will bring us closer to the day when we are free from COVID-19. Beginning this Thursday, vaccinations for those in their 40s and below will kick off. Registration also remains open for those who haven't yet made their bookings.
And those bookings will continue until September 18th. Meanwhile, as of the weekend, over 50% of the nation's population has been vaccinated with at least 1 dose. And that's now, as of this Monday, equivalent to 25.9 million. Now, let's move over abroad. We are seeing the U.S. with 38.5 million cases in total, seeing an average of daily cases in the recent week at around 150,000. There's been a decline in Brazil here with 14,000 infections in the past day, and with some people getting more lax with social distancing measures. But we will take a closer look at how the situation really is in Brazil at a later connection in the program. Meanwhile, over in Iran, there's been the highest single-day death toll on Saturday, with over 460 people having lost their lives. Now, apart from the 20 countries with the highest number of infections, the 21st is the Philippines, which is still seeing over 15,000 cases on a daily basis. And Japan here, more than 25,000 in the past day, just a day ahead of the Tokyo Paralympics. And Vietnam is seeing more than 10,000 cases for the 3rd consecutive day. And this country was ranking 66th as of this Monday, up from 68 just a day ago. And the total number of infections around the world stands at 212.5 million and 4.4 million fatalities. Those are the updates I have for now, but I'll see you back after the government briefing. Sunny?
All right, so thank you for now. Right, COVID-19 symptoms ranging from fever to coughing are commonly witnessed in other summertime sicknesses, making a simple diagnosis quite difficult. We have details in this report.
The summer heat has led to several food poisoning outbreaks here in Korea, raising the alarm of health authorities. Many of those ill said they experienced symptoms that were similar to those of COVID-19, prompting them to get tested for the coronavirus. These patients were in fact under attack from a pathogen, but rather than SARS-CoV-2, the culprit, as it turns out, was Salmonella.
살모넬라균은 주로 닭이나 돼지 등 동물의 내장을 통해서 자연계에 널리 퍼지게 되는 식중독균인데, 식중독 증세 중에는 발열이 생기기 때문에 코로나19에서 생기는 발열과 구별하기 어려운 경우가 있겠습니다. 보통 배가 아프고 토하고 설사하고 이러한 소화기 증상은 주로 식중독에서 나타나는 증상이지만, 코로나19 환자 중에서도 매우 드물게 일부에서는 복통이나 설사를 나타낼 수가 있기 때문에
There are other summer ailments aside from food poisoning that could be mistaken for COVID-19. One of these is air conditioner sickness from prolonged exposure to cold AC units, which can lead to symptoms like chills and fatigue. Also, Legionella bacteria infections are accompanied by symptoms including fevers, coughing, and headaches, similar to what you might expect from COVID-19.
증상만으로는 맹방병이나 레지오넬라병이나 코비드19를 구별하기는 사실 어렵습니다. 맹방병은 이제 주로 열감이 나타나면서 몸이 이제 춥고 근육통이나 두통, 피로감에다가 인후통, 콧물, 코막힘 등의 호흡기 증상이 주로 동반이 되는데 실제로 열이 나는 경우는 드물고요. 코비드19가 유행하기 전에는 주로 이제 냉방병을 의심하고 열이 나거나 아니면은 호흡기 증상이 너무 오래 지속이 됐을 때 그때는 이제 레지오넬라증을 확인했었어야 되는데.
Adding to the confusion is the fact that the Delta variant, which has become the most dominant strain of the coronavirus in Korea, is also characterized by many symptoms that overlap with a common cold. With the loss of smell and taste reported to be less common in the Delta variant, it has become much more challenging to diagnose the strain, judging solely by its symptoms.
뭔가 외부에서 병원체가 우리 몸에 들어온 다음에 그 병원체가 염증 반응을 일으키면 그 과정에서 뭐 사이토카인과 같은 염증 매개 물질이 나타나게 되고 그게 혈액 안으로 들어가게 됩니다. 그럼 그 혈액 안에 들어간 사이토카인 같은 그런 염증 매개 물질들이 열을 올리고 두통을 만들고 근육통을 만들고 하는 거예요.
The lack of physical activity amid COVID-19 and its impact on our immune health means that we should be extra vigilant about our well-being and immediately consult with a doctor if prolonged symptoms appear.
증상만으로는 이런 여러 질병이랑 코비드19랑 구별하기가 참 어렵습니다. 전문가인 저희들도 구별하기가 사실 어렵기 때문에 조금이라도 코비드19 증상이 나타나면 일단은 검사를 먼저 받아보는 것이 필요합니다.
코로나19가 아닌 게 확인이 된 이후에도 증상이 계속되고 특히나 그냥 단순한 뭐 으슬으슬한 그런 뭐 냉방병 증상이 아니라 발열이 나거나 두통, 근육통 같은 전신 증상이 생기는 경우는 단순한 냉방병인 가능성은 거의 없거든요. 다른 감염병일 가능성이 있기 때문에 반드시 의료기관에 방문하셔가지고 진료를 받으셔야 합니다.
When in doubt, the best way to keep safe is to get yourself tested first before getting yourself diagnosed by a medical professional.
Right, it's time now for the regular afternoon briefing on the COVID-19 situation here in Korea for this Monday.
상황총괄단장의 브리핑 설명이 있겠습니다. Let us now begin our regular briefing for August 23rd, Monday. First of all, on the vaccination front, here are some updates. As of today midnight, we have a total of 25.9 million people who have received at least one dose. And this represents about 50.5% of the country's total population. And among them, 11.5 million have been fully vaccinated, representing about 22.5% of the population. And we currently have about 91% of these age groups over the age of 60 and 70 receiving their vaccination, and about 84% of the 80s who received the COVID-19 vaccines as well, and about 76% of these people aged in the ages of 50 have received their first dose. And currently, we are opening the vaccine booking for those aged between the 18 and 49, and we are opening the vaccine until the September 18th. So we ask you to do so if you have not yet made your booking yet. And next, we are also rolling out the vaccines for international sailors here in South Korea. And we have also identified that as for these sailors, we are starting the rollout of the vaccine starting from the 23rd of August. And this vaccination is actually for those people who have difficulties in getting these vaccinations for the age group of 18 and 49 because they have to leave the country due to long periods of sailing, and because they have to be in the vessels for a very long time due to and under 3C conditions. We are rolling out these vaccines starting from today, and about 10,000 people are subject to the vaccines, and those over the age of 30 will get the Janssen vaccines, and those under the age of 30 will get the Pfizer vaccines. And as for the supply of vaccines, we also have some updates. Today we have a total of 1.10 million doses of the Moderna vaccine to be arriving in South Korea. And we have about 25 million doses of the vaccines being received here in South Korea until starting from early July to this August. And we are also continuing to have detailed consultations with the drug makers. And as for the details, we will be disclosing them on a very urgent manner. And we also have some updates on our post-inoculation adverse responses. And out of the entire doses of the vaccines that have been rolled out, we have over 153,752 cases. And we also see that this report rate of these adverse responses are very low compared to the initial stages of the vaccination rollout. And about 95.5% of them are mild symptoms like muscle pain and so forth. And as for the AstraZeneca vaccines, we have about 0.56%, and Pfizer 0.31%, Janssen vaccine 0.68%, and Moderna vaccine 0.35% as for the report rate. And all of those who are receiving the vaccines, we are asking them to stay at the vaccination centers for the next 15 to 30 minutes and also monitor their conditions after returning home for the next 3 hours or so. And also we ask them to monitor their symptoms and conditions for the next 3 days after inoculation. And we are also asking them to go to the doctor as soon as possible if you have any suspicious symptoms. And if you have any clinical symptoms of severe allergic reactions, we ask you to call 911 or either visit the ER. And after receiving the Pfizer or Moderna vaccines, if you have any clinical symptoms of heart inflammation, we ask you to visit a doctor as soon as possible. And after receiving the AstraZeneca or the Janssen vaccines, you could also be exposed to rare blood clots. So we ask you to visit a doctor as soon as possible if you have any clinical symptoms. And moreover, we have had some compensation team that have been looking at the reviews of these adverse responses after inoculation. And And they have continued to carry out these related meetings, and they have been looking at the correlation between these adverse responses and also the COVID-19 vaccines. And a total of 1,800 cases have been reviewed, and about 212 cases have been seemed to have the correlation with the vaccines. And also during the latest meeting, the 27th round of the meeting, we have also looked at a new 500 cases, and also we have looked at 99 cases in total, and we have also seen some cases of the anaphylaxis. And as for one severe case, we saw that this had no correlation with the COVID-19 vaccines, and we also have deemed the correlation to have no correlation with the vaccines as for the 26 anaphylaxis responses, and we are also going to have other cases under pending. And the average age of the death after COVID-19 vaccination, they were over the age of 50, and about 15 cases were received the Pfizer vaccines, and about 10 cases received the AstraZeneca vaccine, and about 29 cases of the severe symptoms. Their average age was about 64, and we also identified about 9.3 days since the inoculation and also until the day of such symptoms. And we have 3 cases of the Janssen vaccine recipients. And we also have some updates on the weekly assessment of our COVID-19 outbreak. During the past week, we have average daily domestic cases hovering around 1,751, which is a 1.6% decrease from the previous week. In the metropolitan area, despite social distancing measures, we are also seeing more than 1,100 cases in the metropolitan area. This is about 2% increase from the previous week. And also in the non-capital area, we have seen a slight decrease in the number of new cases, hovering around 600, and this has been a drop by about 7%. And in the metropolitan area, we have about 1.03, and in the metropolitan area 1.01, which is the reproduction rate. And we also have a total of 54 fatalities during the past week, which is an increase from the previous week. And we also have 53 imported cases on an average daily cases, and this has been an on-week decline. And also in the age group of 20, we have seen 5.9 cases out of every 100,000 people. And also over the age of 70, we are also seeing a continued rise in the number of infections. And we believe that the virus has been spreading through people-to-people contact. And this is accounting for over 40% of the total cases. And we have also increased a number of proportion of cases which are under investigation. And we have also 14 workplace cluster infections and 6 cluster infections relating to multi-use facilities, and also 2 others, and 5 also resulting from academies and so forth. And looking at over 60,000 COVID-19 infections, we have seen about 93.4% of them having no inoculations, and about 1.4% received the first dose. And we have a total of more than 1,000 people having critical symptoms, and a majority of them did not receive their vaccines, and about 1% received only 1 dose, while 0.6% received their 2 doses. And also above the age of 60, we are also identifying a majority of them have been those who have only received 1 dose. And as for this age group, we have about 83% of the cases, infections who have not received their first dose, and about 1% of the people have been fully vaccinated in this age group. And also last week, we have had many people returning from their summer vacation, and we are also having further risks of COVID-19 infection. And also with the beginning of the new school semester, we believe that there could also be more risks of COVID-19 infections. And reflecting the fact that we have many silent spreaders who are asymptomatic within our society, we believe that there could be another surge in the number of infections. So we ask you to also monitor your conditions going forward. And at schools, you need to wear your face mask and also have regular ventilation. And we have seen a slight decline in the people movement during the month of July. However, this has been making a rebound in the month of August. And we believe that we could see a rebound in the infections after people return home from their holiday destinations. And even if you do not have any symptoms, please also get tested at the makeshift testing centers at the rest stations in the expressways before heading home. We believe that this could be effective in also tracing the patients going forward. So we ask you to get tested even though you don't have any symptoms. And during the August 13th and 18th, we have had makeshift testing centers, and we will be extending these makeshift testing centers until the end of Chuseok holiday. And we will also set up more additional centers nationwide with the consultation with the local governments. And also going forward, we will also have an ease in the cap on the private gatherings of people who are meeting after 6 p.m. And we believe that up to 4 people can meet and gather after 6 p.m. if the party includes at least 2 people who are fully vaccinated. So under these ease regulations, it is very important that we continue to abide by quarantine measures. So we ask for the staff members at cafes to also monitor well that these people have been fully vaccinated. And we ask for your continued participation in these COVID-19 restrictions going forward. And lately, the KDCA has been reporting some of the fraud cases of the fraud phone calls in relation to the COVID-19 vaccination certificates. And please note that the KDCA does not ask individuals of their personal identification information. And we believe that we are also enabling people to download their personal identification authorization through their own mobile phones. And also our official text messages are sent out by our official KDCA telephone number as well as 1339. And we do not send out text messages under the phone call that starts with 010. So for the details, we ask you to monitor the details and refer to the details that are given by the cybersecurity authorities. And last but not least, starting from today, we are extending the social distancing measures for another 2 weeks. And we believe that many people are going through difficulties in terms of their daily routines. However, it is very unfortunate for us to only have to extend such restrictions during the prolonged period of time. However, if we stay complacent at this moment, we believe that we can see another big surge in the number of cases, and we believe that these have been witnessed in other countries worldwide. And please also, we ask you to continue to endure with us going forward and participate in the social distancing measures. We need to contain the spread of the COVID-19, and we need to expand the COVID-19 vaccinations, and we believe that this can help us to contain the fourth wave. If we have concerted efforts, we believe that we will be yielding fruitful results going forward. And even in countries that have high COVID-19 vaccination rates, they are experiencing rebound in the number of COVID-19 cases. And relatively, we are having a small number of COVID-19 infections. And going forward, we will be able to contain the COVID-19 spread here in the country. And right now, we are opening the booking for those aged between the ages of 18 and 49. So please make your reservations if you have not done so yet. And this will continue until the month of September. And even at this moment, we ask you to also, we would like to thank you for your continued participation. And going forward, even at this very moment, there are many people who are exerting their full efforts. So we thank them once again. The government will also exert our full efforts to contain the virus going forward and roll out our vaccines. Thank you very much.
지금부터 기자님들 질문에 답변 드리는 시간 갖겠습니다.
Right, that was Baek Young-taek with Monday's afternoon briefing, and I have Soa here at the desk with the gist of his address. Soa.
Sonny, there's been a slight decline in COVID-19 infections in the past week by 1.6%, with an average of around 1,750 daily domestic infections. That's a drop in the non-capital regions, but a rise in the capital region, with the officials stressing that the summer holidays are not over yet, and also asking for people to make use of the temporary screening centers at rest areas at certain expressways, which will be extended until the end of Chuseok holiday. And a quick update on the vaccination front. Inoculations for sailors on international seas will start today, and that because they are prone to virus transmissions due to the confined and crowded space on these ships.
Of course. All right, Soa, thank you very much for that.
My pleasure.
현재는 예방접종의 전파 차단과 치명률 감소 효과가 충분히 나타날 때까지 유행 수준을 최대한 억제하는 노력이 중요한 시기입니다.
모더나사가 향후 2주간 총 700만 회분의 백신을 한국에 공급하겠다고 정부에 알려왔습니다.
Level 4 and 3 COVID-19 restrictions are in place nationwide to contain the fourth wave here, which has been aggravated by summer holiday travelling and the presence of the Delta variant. For more on this situation here and elsewhere, of course, I have Professor Chung Gi-seok from Hallym University. Welcome back, Professor Chung.
Thank you for having me.
And joining this session virtually is Sarah Coates at I-24 News over in Israel. Sarah, hello, it's a pleasure.
Thank you so much, Sunny.
I also have freelance journalist Luana Ferreira over in Brazil, live on the line. It's good to see you again, Luana.
Thank you for having me back, Sunny.
Right, then we'll start here in the studio. Professor Chung, social restrictions have been extended yet again, but this time with a few modifications. Under level 4, we have restaurants and cafes who need to close doors by 9 p.m. And social gatherings can have a total of 4 people if 2 are fully vaccinated. What are your thoughts on these measures?
Well, the government has already announced 2 months ago about the vaccine incentives, like exempting counting people from restriction of gatherings on people who are fully vaccinated. And they even suggest about travel bubble for fully vaccinated people. But all of a sudden, those incentives disappeared because of a fourth wave we are going through. So that was due to apply from 1st July, but now, it's the end of August, we are seeing a very minor incentives, which includes 4 people is allowed, which you have in which you have 2 or more fully vaccinated people. That's the good news. That's the way to with Corona policy. But here in Korea, we have 11 million people who are fully vaccinated, but most of them are aged 60 or older. And other people are residents in nursing homes, long-term care facilities, and doctors and nurses, firefighters, and police people. So there are not many people who are frequently going to cafes or restaurants, but I hope there will be more guests in cafes and the restaurant. But what I'm missing is that if you allow 4 people in bars and restaurants, cafes, then why do you ban still the family gathering in households? And why do you ban indoor and outdoor sports, which do not produce much droplets? So we have to weigh between allowing only cafe and restaurant and allowing family gathering is our basic instinct to get together.
Right. Professor Chung, it appears Korea and Romania are engaged in talks over a possible vaccine swap deal. How do you respond to such procurement efforts by authorities here?
Well, I'd like to thank Romania for a swapping effort for Korea. The 450,000 vaccine is not a small amount. We can use it to first increasing the first vaccination or completing the second vaccination in a very short time. And I heard that Romania has got a PCR test kit last year in March, early March. That was a time for many countries in competition for a diagnostic kit very eagerly. And I thought that Korea has helped them in that way. And this is a kind of a payback from Romania to Korea. So there will be a mutual help, reciprocal help from Romania and from Korea's side. So I do hope that both countries will help together to overcome this COVID pandemic.
Right, hopefully.
Yeah.
Meanwhile, Sarah, despite the high public inoculation rate there, I hear Israel has been responding to some 7,000 infections on average over the past week. Could you start with a bit of the COVID-19 situation there and how authorities in Israel are explaining this resurgence?
Yeah, you're certainly right about that, Sunny. The numbers of the case numbers have really jumped up double in the last 2 weeks. It was only a couple of weeks ago we were seeing cases in the low thousands. Now we're seeing more than 7,000 cases every single day. And, you know, this is highly concerning given that 80% or so of the population has been vaccinated. So at this stage, I'm sitting here in a shopping centre. I'm sure you can see behind me here people coming and going. These are the people coming who are over the age of 40 to come and get their third booster shot. So now the government has been basically rolling out this third vaccine, starting at the top, originally for people over the age of 70, and then bringing it down to these younger age groups. So already we've seen more than 1.5 million people who are eligible for this third booster shot to come and get it. And this is because they have found here, scientists looking into this new wave of coronavirus have found that after 8 or so months of having your second vaccine, that your antibodies really begin to decline to a point where the vaccine isn't really covering things like the Delta variant, which came into the country a few months ago. So there is quite a lot of concern regarding just how much the vaccine will protect people against the Delta variant, which is why the government is rolling out this third booster shot, along with a decision which has just been made that the school year will begin on the 1st of September, and they will have mobile vaccination facilities there at these schools. So if parents do give the permission for their child to be vaccinated, they will actually be vaccinated at school as the school year kicks off. Now, if they aren't going to be vaccinated, they must show a negative PCR test or actually have a serological test to be able to begin the school year.
I see. And meanwhile, Luana, Brazil, I believe, is also battling resurgence there. How severe is the situation in Brazil, Luana?
Actually, last week we had an average number of 773 deaths per day in Brazil. Although the number is high, it's the lowest rate we have since January, and it's a huge improvement if we look back some months ago when there were like 4,000 people dying per day in Brazil. Of course, it's not a coincidence that the number starts to slow down when the vaccination finally started to move forward in Brazil. Right now, we are dealing mostly, not only, but mostly with two variants, the Gamma variant and the Delta one. The Gamma variant is still predominant in most parts of Brazil, except for Rio de Janeiro, where the Delta variant is already surpassed the Gamma one. And however, the scientists believe that, like what's happening all over the world, the Delta variant will take over Brazil from September on.
And Luana, against this backdrop, what can you tell us about the measures in place to contain the COVID-19 situation in Brazil?
Well, it's different in each state because the measures they are taking depending on how full the hospitals are, how is the speed of the vaccinations in that state. So it's very specific for each place. For example, in São Paulo, 85% of the population has taken at least one dose of the vaccine. So now they're starting to open again. They are allowing events, but with social distancing. And as long as there is no agglomeration, in Rio de Janeiro, from September on, they will allow for the first time the public to go on a stadium to watch soccer match, but only with 50% of the capacity.
I see. And back in Israel, Sarah, what can you tell us about the rate of breakthrough infections there, and what has been shared about the symptoms of these patients, Sarah?
Yeah, so at the moment, they are saying that about 50% of these people who have been hospitalized have actually been vaccinated, although these people are showing much less severe symptoms than these people who have been hospitalized and are unvaccinated. The majority of people who are attached to respirators or are suffering, really extreme COVID symptoms are these people who haven't been vaccinated. And there have been some stories in Hebrew media over the last few days of people on their deathbed saying that they wished that they'd gone and got the vaccine, but they actually thought they were doing the right thing, and if they could go back, they would. So this is, most of the people who are in hospital are suffering from being infected with this Delta strain, which, as I mentioned a little earlier, and as the world has been reporting, is much more highly contagious and more resistant to the vaccine. Now, we're also seeing a number of people here in Israel hospitalized with the strain known as the Delta Plus strain, which has been identified here in Israel just a week or so ago, with concern over another strain, the Lambda strain, which hasn't yet entered the country. But this is why they are just putting so much emphasis on quarantine upon arrival into the country, and also PCR testing there at the Ben Gurion International Airport.
Right, of course. Meanwhile, Professor Chong, there have been breakthrough infections here on the local front as well, including one cluster case at a nursing home. How do you explain this reality?
Well, there are several factors on explaining that. First of all, they are elderly, mostly elderly people. Being old is another risk for infection, and they have lower immunity despite they have vaccination, and they have lower antibody titer, so they cannot continue their higher antibody titer until late time. And the second one is mostly the residents in nursing homes got a second vaccination in May and June, quite a long time ago compared to the other people who are being unvaccinated. So it's about time their antibody titer to be decreased rather than persistent. And more importantly, that I have to mention about their environment. They are very confined space and crowded population over there. So, for instance, when it rains, you use umbrella. When you use umbrella for 30 minutes, 1 hour, it's okay. But when it rains whole day and you're using umbrella, you are well enough to get soaked. So that's the same condition. Umbrella is the vaccine. Even the vaccine is effective. If it rains too hard, if the viral load is too high in a confined spaces, you cannot avoid getting infected. So in those cases, I like to recommend the more frequent PCR testing in those facilities, and getting a booster shot in priority, and keeping the personal hygiene like mask wearing and hand hygiene.
Right. Luana, the city of Rio de Janeiro, that is mandating COVID-19 vaccinations for its public workers. Could you tell us a bit more about this and the public response to this mandate?
Yes, of course. They made it official last week. So the public workers who refuse to vaccinate, they can even lose their job. So it's going to be a huge motivation for them to vaccinate. However, the City Hall of Rio de Janeiro is not alone on that, because it's also being done on private companies and even hospitals. If a person refuses to vaccinate, they can be fired. And there is divided opinions about that, because in Brazil, it's not mandatory to have a vaccine. You have the free right to not be vaccinated. However, it comes with consequence, and losing your job is one of them. According to the Brazilian justice, your individual rights cannot cannot surpass the well-being of a society. So if you don't take for a vaccine, according to some lawyers, then you're putting the risk of people you're working with. So therefore, there's no punishment for companies that decide to fire someone for not taking the vaccine.
I see. And staying there, Luana, I understand the city itself is planning to fully reopen its doors on the 2nd of September with 4 days of special events across the city. Is the city ready to do so, in your opinion?
You mean the carnival?
Yes.
Yes, actually, it's a plan of reopen because they expect that Brazilians will be fully vaccinated in December. So they have announced this year we did not have Carnival, which is the biggest festivity we have in the country. And they announced last week that we're going to have 40 days of Carnival. Also, people are excited about it. They're also taking it with a grain of salt because what's happening is that we don't know what's going to happen in the coming months. And it's not just in Brazil, it's like in the whole world. We don't know what's going to happen with the Delta variant, if we're going to need extra vaccines. So we don't know.
Right. Sarah, I understand authorities in Israel is calling on anyone aged 3 and above to provide proof of either a COVID-19 vaccination or a COVID-19 test that shows a negative result before entrance to outdoor spaces. What has been the public response to this?
Yeah, that's right, Sunny. So this green passport system has been reintroduced. It was brought in during the first sort of wave of coronavirus here and really only used for a very short time because of the vaccine rollout here, because it was so very fast. That has now been brought back in with these outdoor gatherings of more than 100 or so people must show this proof of vaccination, proof of recovery, or a negative PCR test to be able to enter these venues. That is also, that goes for places like restaurants, bars, clubs, etc. Now, one of the interesting points here is that children under the age of 12, before this, were exempt from this green pass system, but they are now known as, the group here in society who are spreading coronavirus around just due to the fact that these children under the age of 12 prior to this weren't being vaccinated. That will change, as I mentioned just a little earlier, when they go back to school. But this is really trying to, ensure, obviously, that anyone who does enter these sort of events is recovered or vaccinated. So this is hopefully going to bring these coronavirus case numbers down.
Right. And back here on the local front, Professor Zhang, authorities have claimed an exit strategy from COVID-19 may be considered in late September or early October. What are the variables then that may perhaps hinder such plans?
Well, there are several factors. That's the way we should go, but not now, in my opinion. First of all, we should complete 70% of fully vaccinated of whole population. That means at least 1 in 2 have an immunity to COVID-19, even though that's not for a Delta variant. And secondly, we need lower severe cases with the Delta virus. Currently, 33% or 2% are getting into severe and very severe cases. But I hope at least 1% should be reached before we go to with corona cases. And also with the case fatality. Case fatality now is around 1%. But particularly with Delta variant, it is 0.26%, not a bad number. But if you look at the influenza mortality rate, case fatality, it's 0.03. Was 0.03 in swine influenza several years ago. These days, people say that it's 0.1% to a 0.05%. But I insist that at least 0.1% below should be reached before we could discuss with corona policy.
Right. And very briefly speaking, Luana, I understand authorities there in Brazil have vowed to inoculate all adults by end of October. How feasible is this plan?
Well, actually, right now we have nearly 60% of the population vaccinated with at least one dose of the vaccine. Until yesterday, we had vaccinated 57% of people in the country, and 25% of the population is fully vaccinated. Also, the Health Minister, Queiroga, has said that this week, specialists believe that it will only happen in December due to the different speed of the vaccination in the whole country. As we know, Brazil has a continental dimension, so the speed of the vaccination in São Paulo is different from the vaccination in Pará, for example. Each state is moving in different, with a different speed.
I see. All right, Luana, as always, thank you very much for your thoughts. And Sarah over in Israel, thank you very much for making the time to join us live today. And
My
back
pleasure.
here in the studio, Professor Chung, thank you for your thoughts.
Thank you.
Right, the persistent pandemic has made the need for a sustainable COVID-19 response plan all the more important. Thank you for watching. See you on Tuesday.